So I am the current president of the Sudanese Medical Association in UK and Ireland. I am the vice president of the Supreme Council of Sudanese Communities Abroad, which is an alliance of 120 communities all over the world. And I am also the chair of the board of trustees of Incapacitated Region Water Aid. I'm going to talk today about a model that's set by Muhammad Shumu that we haven't, when we did it, we didn't have all this beautiful knowledge and graphs and slides, but we had the good intention to do something good to our country. So, I'm going to move with the right one?
Just the right one, yes.
I'll just give you a historical background about the Sudanese medical links to UK. That started in 1924 by the graduation of the first batch of doctors from the then called Kitchener Medical School. That was later amalgamated in 1952 to Khartoum University College, and 1956 by being amalgamated to Gordon Memorial College to become the University of Khartoum. To move a step further, postgraduate studies until mid-1970s, the doctors they used to come to UK here to specialize. Mid-1970s, there was establishment of postgraduate deanery in University of Khartoum, and they started most of the clinical specialties. Still, there were some few specialties that they come to UK and specialize, like my own specialty, which is histopathology, plus the other basic sciences. And another event that happened, which is important, there were two surges of immigration from Sudan to UK. They started late 1970s, and another surge in 1980s. Both are politically related. There were some immigration before that, which is economically related to the Gulf region, but to UK mainly, it was based on inside Sudanese politics. And we've been told this information by the registration section of the General Medical Council in UK in March, 3 months ago, when the president of the Sudanese Medical Council visited UK by invitation from our organization to identify the systems and establish cooperation with the DMC. They told us that the Sudanese doctors, or Sudan now is the third country providing doctors to UK, and we came after India and Pakistan. We have overtaken Nigeria, and we have overtaken South Africa and Egypt. So this shows the magnitude of the number of Sudanese doctors here in UK. Back to Sudanese Medical Association, we set a consultatory meeting in June 2009 here in London, attended by 25 senior doctors from all over UK. Most of them, they have initiatives, individual initiatives to do in Sudan. And we sat and discussed the viability of making a just an organization that include all these initiatives. And in December 2009, we published our foundation declaration. And in March 2010, we had our foundation AGM. We set to ourselves a set of objectives, about 10 objectives. Interestingly enough, the first one has said that to place emphasis on the purely professional, non-political activities. And this will tell a lot. I'm going to talk about that later on. Second, working towards our members, creating professional and social links among the members, which is quite logical. After we do that, then we provide advice and support for health services and medical education in Sudan, and also contribute in transferring the knowledge to Sudan. The fourth objective, research, and the fifth objective is to support the training of medical students at both levels. Number 6, to organize health convoys. Number 7, to maintain recognition of the Sudanese bachelor degrees by the NARIC. NARIC is a recognition center here in UK, and at the time of the establishment, this is a historical thing related to the time of establishment, there was an issue of recognizing the Sudanese medical degrees, if you could remember. We helped into sorting that issue with at the time of our establishment. And we put it as, we will work as a safeguard for maintaining this recognition. And also we are open to cooperate with organizations inside and outside Sudan which have similar objectives to ours. And the difference between what we have said and what was present is that we decided to be a multidisciplinary organization rather than a doctor's club. Before that, before this foundation of our organization, there was a small organization for doctors only called Sudan Doctors Union, and that they mainly focus on general issues, policy issues, and politics-related issues. So we decided to set up a multidisciplinary sort of organization that includes everyone in the health sector. And the final objective is to create links with an institution here and in Ireland as well, because the organization has got 2 links. And the materials and methods are very simple. I have just inspected the documents that we have, mainly the governing document, setting the objectives and trying to investigate the implementation of these objectives in our practice in 6 years' time. I have made use of my personal collections and also the website. This is the website of our organization. And then I just talked about every single objective and seeing how much we have achieved. The first objective, as I said, is very interesting, and that's because of the environment that we are having here in London and even back in Sudan. I mean, the doctors and medical community are very political creatures, and they have a high emphasis on classifying you according to your political affiliations and party membership.
Sometimes before that.
So we made that very clear that we are non-political. You said it, the first one. It's not an objective, I mean, to be non-political. Yeah. It's not an objective that you need to achieve, I mean. You are stating a statement, but it's very important to say it. So we put it at the first one. And what we've done, I mean, just we want to ease the polarization of people, and you need, in each organization, they need to find one person who has got a political affiliation to label the whole organization with that political affiliation. And the affiliation, you could either be a pro-government or a pro-opposition. And opposition, there is organized opposition and there is non-organized opposition. And if you don't have an affiliation, you are by default a pro-government. So that's the way it works. And we have been classified as a pro-government, unfortunately, and that delayed us in the recruitment in the early phases. I mean, until people now recognize that we have nothing to do with politics and we are doing a professional work. But the early years, we have been classified, and there was a lot of polarization, and a lot of articles went into Sudanese Online, Rakuba, and everywhere. So we had a period that we had very tough time. So, so our second objective was just to try to get people together and try to make some social events and provide services for junior doctors who come to UK. And we managed to provide an attachment for at least 70 young doctors who came here without any work experience in UK. Through our consultants, through our group, we placed them in attachments, and then they started their first jobs in the system. Some of them now are young consultants or senior trainees. And we didn't do that. We went to Sudan as well, and we trained doctors there in Sudan. And we had also a difficult time in Sudan, because when we wanted to work with the Sudan Doctors Union, we had a lot of opposition from people who are attending the activities. We just wanted to use the free venues and use the facilities there. And some of the junior doctors who are beneficiaries, they thought we are not going to go to the Sudan Doctors Union premises. But we try to iron all that differences. We tell them, look, we are professionals, we want to provide services, we want to provide help to you, and it doesn't matter. I mean, the Sudan Doctor Union is you. They pay subscription. These subscriptions are deducted from their salaries to the Sudan Doctors Union, and they do not want to use the facilities provided by Sudan Doctors Union. So the polarization was very difficult. Eventually, we started to make things working, and we started to work with everybody, universities, Sudanese Medical Specialization Board, and there is a presentation which will show you what has been done in that regard, Sudan Medical Council, and the Sudan establishment. Because if you want to help Sudanese people, you have to get through the doors which are there, the establishment. You cannot do any work and help to Sudan without getting that through the official channels. And eventually this message has gone through, and we developed about 6 conferences in Sudan, international conferences. I'm going to tell you about this. This is just what we do here in UK. This is a visit to Alton Towers. Most of these are junior doctors who have been helped by us to get into the system. This is one of the interview skills that we offer to our candidates. I have been warned actually by 2 minutes, not have been told about the 5 minutes.
You were told.
Okay. I'll just try to flip over.
Yeah.
We provided advice and support for health services and medical health education in Sudan, and contributed to transfer of knowledge and technology through our conferences. 2,000 people participated in these conferences and benefited from the knowledge that had been transferred to them, and 1,200 participated in our workshops, which is a direct experience, hands-on experience by very high professionals and expatriates. About 15 to 20 expatriates from UK and Ireland have helped us in this mission. These are the workshops that we have set during this time and the conferences. The last one was about ethics and professionalism. And from that conference, we had the visit of the Sudan Medical Council president here to the GMC and set in collaboration with the GMC. This is one of our conferences. From Meda, he is the Minister of Health in Khartoum State, Professor Sheikh Mahjoub. This is an international figure, and that me hiding there as well.
I'm not smiling.
This is Sudanese identity.
And here looks board also with a very lengthy presentation from the ex-president who was making summary on this conference, same like Adil. I was about to have a nap like Alam in this presentation. And research and publication, this effort here is part of that, but we are planning to have a journal that will we could publish through it our work and other scientific work. Accreditation, as I said, that we help bodies in Sudan to liaise with bodies here in UK, Irish Medical Council, GMC, St. James Hospital in Dublin, etc. Health convoys, we haven't done much of that. We went to Jazeera, Madani, and Sennar. This is in Sennar Dam here. This is one of the expatriates, another one professor from Glasgow University. This is in Sennar University, which used to be my secondary school. Maybe the same class that I studied my high secondary education now is Faculty of Medicine in Sennar, which is my hometown. And this is the visit of Professor Zain Al-Abdin Karrar to the GMC here in London. It was a bit cold, so that the reason of the scarf.
And the smile.
And I have a smile as well. This is our last meeting in Manchester, trying to bring people together on a hot meal there, donated by one of our friends in Manchester. And this is a leadership training. This is Abdurrahman, who is going to talk maybe next or after next. And that me, smiling or not, I'm not quite sure. And I think that's basically what we've done. I just want to mention two important things. That this polarization for Sudanese diaspora and politicization, it needs to be sorted out. Otherwise, we cannot move forward. I mean, this is an example. We have suffered. We've gone through, but not everybody is prepared to suffer and prepared to be smeared, prepared to be classified, prepared to be written about them, notes in websites, etc. I mean, that's bullying and harassment. And I think we need to agree that we want to work for the Sudan. That is our aim, that is our objectives, and we have to do it together. Set aside our differences, try to focus on helping our people. Politics has got people who know how to sort it out. We don't want to interfere.
I don't think so, but that's a different issue.
Yeah, the other thing, the last thing here I want to mention that we've done a lot of work and we need to monitor the impact of that work. I mean, the effect of this on the systems in Sudan. Maybe Dr. Sheikh and Ayad and the other people who work in the sector may help us in trying to monitor whether we have made an impact or not, and what went right, what went wrong, and how to develop that. Lastly and importantly, we are moving to form an international organization, Sudanese Medical Association International. We want to help all the efforts of diaspora to get into the same boat, to do the same work, magnified, done by multiple groups, multiple people for the sake of the Sudan only. And we hope we are going to succeed in that, and we have less attacks, less smearing, and less harassment. Thank you very much.